Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. Today I'm coming to you from our Murrells Inlet office down in South Carolina. This is our latest edition of Dr. Ray TV. Today we're going to talk a little more about chronic pain and spinal stenosis. And I tried to give everyone a lot of good information on different cases that I've seen. This is actually a case that I saw today and we were able to help someone out. So we had a patient come in and he was a great older man, retired, really good shape, but he had a lot of issues going on. So he had some spinal stenosis, he had a previous back surgery, and was fighting some other conditions going on. But overall in good health, his spine has really degenerated. So what is spinal stenosis? Well, spinal stenosis is a degenerative disorder, and it can cause you quite a bit of problems in your back. So this particular fella had it in his mid to low back. And what happens is when you get stenosis from severe degeneration, it happens from the disc herniating, the jointed stuff degenerating, so we have a decreased disc height, we have some arthritis, we have compression, and the hole where the spinal cord is has gotten smaller because of the degeneration. So that alone can cause some pain. Very, very difficult to deal with and to manage. For some people, it's actually a surgical consultation. But for this gentleman, he already had surgery on his low back, and the ones above it were beginning to degenerate and beginning to show some spinal stenosis in there. So how in the world can a chiropractor help? Well, let's start things off by, I'm not going to be able to fix it. When it gets to this point or this chronic condition, it is a pure management issue, okay? Besides surgery, everything that everyone's doing is going to be completely a management issue. And this man had already had, or this patient had already had epidurals, so spinal injections to try to decrease inflammation, which gave him some relief, and he's gone the whole medical route. He wanted to give chiropractic a try to help alleviate or manage some of the pain. So how will we do this with someone? Well, at this particular patient's age and the shape of his spine, or the degeneration of his spine, a manual manipulation would probably aggravate things, make things worse, cause him quite a bit of pain. That wasn't the route to go. And he actually found me because he didn't want to go that route. He found us online, knew that we could do different procedures to get him to feel better. So the first thing that we did to help manage or help relieve some of his pain from his spinal stenosis or his chronic pain was to do a bunch of muscle work. So we did some active release technique on him. We loosened up his legs, his low back, his neck, his upper back, his shoulders. I'm trying to loosen all the muscles or supporting muscles that are attached to the spine in order to allow more mobility. When we're looking at severe degeneration, our goal is to loosen everything up to hopefully take some pressure off it so it doesn't hurt so bad. So the first thing we did was a lot of myofascial work or muscle work. The next thing we did was some cold laser. So we used some cold laser on different myospasms or trigger points along the side of his back and in his pelvis and in his sacrum, and actually in his neck, in order to break up some scar tissue, release those trigger points, to allow for more mobility of the muscles, more mobility of the spine to decompress it. So again, we did some muscle work, then we did some cold laser. The next thing we did was some stretches. We stretched his arms, his shoulders, his neck. We stretched his legs out in order to loosen everything up, again, for the main goal to decompress things. After that was done, we used a handheld instrument. So it was an adjusting instrument, electrical adjusting instrument that you see on a lot of my videos. And we realigned all the joints. We broke up some more scar tissue around the spinal vertebral bodies, and all allowing for more range of motion. So what is our goal here? Or at least my goal anyway, was to decompress the joints, okay, as much as we can, realign them so they have better function, less pressure on the nerves, increase range of motion, get his body working better, functioning better, and try to decrease some inflammation. So our goal is the same all the time. When we have someone with chronic pain or with spinal degeneration, we have to be much more specific in what we do. Manual manipulation may not be the way to approach that situation. Using the adjustment instrument is the way to go with that. Okay, so if you have some severe degeneration out there and your back's been hurting you or your neck's been hurting you and you're not sure what to do, get a hold of me. You can always message me on Facebook. We can talk, see if I may or may not be able to help you. If I can't help you physically, I'll make sure I get you to the right person that can. All right, I hope everyone's doing well out there. It's going to be beautiful out here down in Murrells Inlet tomorrow. And try to enjoy the day. I will be in the office from 8 to 10, so if you're out there, stop in and we'll get you adjusted. Have a great day. We'll talk to you soon. Bye-bye.